Tonight, many health providers all over North Carolina are requiring their employees to get vaccinated. Good evening, everyone. I'm Rod Carter.
And I'm Angela Taylor. Looking at the latest metrics, now is a good time to think about vaccinations if you haven't already. A big jump in cases from yesterday, 1,800 new cases. That's the largest increase since early May.
So new at 11, CBS 17's Nick Sturtevant is joining us now live, getting answers about why hospitals are just now requiring vaccines. Nick.
Yeah, you guys, the list of healthcare systems that are making it a requirement was announced today. Not included 2 healthcare systems in our area, and it has people that we spoke with earlier feeling a little uneasy.
Hospitals in the Triangle jumping on board following North Carolina Healthcare Association's announcement supporting required vaccinations for healthcare workers. However, WakeMed and Cape Fear Valley Healthcare have decided to take a different approach. In a statement in part from WakeMed, quote, discussions about this topic have been ongoing among members of WakeMed's executive leaders, vaccine planning team, and others for many months. With this in mind, we anticipate that WakeMed will require vaccinations of all employees, providers, and volunteers in the near future. They also said they have no firm timeline at this point. They are working to figure out what this requirement will look like. Cape Fear Valley Health told us while they are strongly encouraging employees to get the vaccine, quote, they are still gathering and assessing feedback before making this decision.
I think if given the opportunity to be around and be cared for by someone who has had the vaccine, I would obviously choose that.
Especially healthcare workers and people on the front lines, like you would think that they've seen the worst of COVID for the past year and a half, and I would like to think that most of them would want to be vaccinated only because they've been putting their lives at risk, their families' lives at risk.
Sean Avery and Adrian Kelly were not the only ones who felt this way.
At the end of the day, I want the people who are giving me care to also be well, because I also do realize that if you remember last year, hospitals were filled up with COVID patients.
And to be fair, we spoke with some people who say, hey, I'm vaccinated, so it doesn't even matter if employees at the hospitals are vaccinated. Now, earlier, CBS 17's Mackenzie Stasko spoke with Duke Health, and she found out either employees get the vaccine or find another job.
Duke Health employees got this letter today to continue working. They'll have to be fully vaccinated and show proof by September 21st.
And we've seen an uptick in hospitalizations locally, regionally, nationally, and an increased rate of infections among team members. So all of those signals put together suggested to us it was the right time.
Other hospitals feel the same. UNC Health, Atrium Health, Cone Health, Wake Forest Baptist, and Novant Health will now require employees to get the vaccine.
Or if we hadn't seen the emergence of more virulent or more contagious versions of the virus, like the Delta variant, then it might not have been necessary.
Right now, there are 48 COVID patients within the Duke Health system. That's double from 2 weeks ago.
At Duke, we are sequencing the virus to look at those trends as others are around the country. And as of last week, more than 82% of the patients with COVID that seek care at Duke now have the Delta variant.
Out of the 11,000 people who work at Duke Hospital, 77% have voluntarily got the vaccine. Dr. Fulkerson says it's progress, but not enough to protect patients.
We have lost far too many members of our community to COVID. And I'm worried we will lose more without further efforts to vaccinate our population, our people.
And I do want to point out, according to Duke Health, employees that have religious or medical reasons for not getting it can apply for exemptions. We are also told pregnant employees are on that list and won't have to get the shot until they return from maternity leave. Live in Raleigh tonight, Nick Sturtevant, CBS 17 News.
All right.